I've been very impressed with the product on a clinical basis. It has some unique characteristics I haven't found in other composites, especially for posterior use. Its ability to be injected, to flow, to sculpt it, to handle it, and the polishing characteristics is really incredible. It's been enjoyable during the placement process. The properties of it make it very useful and user-friendly for the clinician, and being able to place this in one fell swoop really makes a difference. As we look at some of our clinical issues that we run into on a day-to-day basis, especially the fact that posterior composites are probably 80% plus of what we do as clinicians when we talk about direct restorations. As a clinician, you want to make sure you align yourself with the company, with the system that can provide you the best end results, the least amount of time, the accuracy, and the dependability. So when you go ahead and undertake these procedures, some can be rather daunting, that you have an outcome that's going to be deemed successful, free of problems, easy to place, and something which is going to be durable and last for a long period of time. So if you put all these things together in this system, which you have, compiling both the adhesive like the Scotch-Bond Universal and the wonderful characteristics of this material, the high polish, high abrasion resistance, high compressive strength, it has all the features and capabilities that we deem important for a posterior restoration which is going to undergo function, and also has the beauty, the aesthetic beauty that we need to have for tooth color restorations. We've done quite a few restorations already, and I've been impressed with the fact once it is placed how well it adapts to the cavity preparation because of the fact that we can inject it very easily and adapts well to all the various designs, even the very deeper preparations into the box portion, interproximal. I like the fact that we can use our traditional application with our composite gun or delivery system that we're familiar with. It's easy to change angles, it's easy to get any area that you need to posterior. The fact that we don't have any foot pedal to deal with, we can deliver as much as we want. The fact that we can control the speed and the extrusion force, being able to really control, making sure we're careful to cover the entire lining inner portion of the preparation, to me makes a very easily identified type of procedure, and using familiar products and familiar equipment, and we don't have to worry about having to deal with any types of other outside equipment which may hamper our placement because of the size of the equipment, the speed and the weight and everything else. So to me, marrying the typical delivery system, compules, and placing it with our delivery syringe really makes a lot of sense. We have no problem get placement of any preparation design anywhere in the oral environment. Well, it has many features that I think are going to endear it to the clinician, to the clinical team really. Combine that with like Scotch-Bond Universal, one-step type of adhesive, a very dependable adhesive. The fact that you can get in there and place these sometimes difficult restorations and have the confidence that the restoration is being placed accurately, and you're going to end up with an end result which is really favorable, very successful. And once this is done on a continual basis and you learn all the various facets you need to undertake and successfully complete restorations, this is going to benefit you, it's going to benefit your practice, patients are going to be happy with the work that you've done,